Hey guys, this is for discussion 6. Okay, I didn't want to read the scenario because everybody's read this scenario, but so first things first, how would you approach the child, the 7-year-old boy? A first thing for me, being a parent, having a child that for a while was a little leery of strangers, I would definitely talk to mom first in front of him so that he sees that it's okay. You know, this is somebody that's not going to hurt me. Mom's right here. Mom's talking to them. I feel that that always helps quite a bit. I would also, you make every move known, what you're going to do, where you're going to touch, when you're going to move. I know that sometimes we stop that once kids hit a certain age, but I do feel that it's still vital, especially when kids clearly aren't feeling well or are injured. I mean, they're scared or they don't feel good, so, you know, their little emotions get the best of them sometimes. So I would make sure to announce everything verbally and clearly, you know, maybe by telling him, I like to use the close-ended questions with kids like that because, you know, hopefully by this point mom's given us a name, and so say it's Billy, you know, I'd say, hey Billy, you know, I'm gonna come over and talk to you, is that okay? Hopefully we get a yes. If we get a no, there's ways to press without pressing and making a child more afraid, but generally with this kind of deal, you get a yes. So I would just go closer and talk to him, ask him some questions, even if it doesn't pertain to his illness at the current time, just making him feel comfortable with you being right there. Then I would proceed with still the closed-ended questions. Billy, you know, I'm gonna have to touch on your stomach, is that okay? Yes. Touch. Then, you know, Billy, I'm gonna have to push on your stomach. I need you to tell me if it hurts, or your belly, or whichever term you prefer to use for a child at 7. I would probably, at 7, I'd probably go with stomach. Under 5, probably belly. So I would stick to doing it that way. How would you conduct your physical exam? It's still the same thing, verbalizing everything, making sure everything is clear to him before you do it, because if you move, and I'm not talking about like with small children, you move too fast, you scare them, but if you just grab his arm and go to put on a blood pressure cuff, he's liable to be upset. So it's just verbalizing each individual step that you're going to do. Each individual part you're going to touch, everything. Verbalize. If he gets uncomfortable, you stop what you're doing. If you're trying to put a blood pressure cuff on and he gets scared, you stop applying it. I like to still keep it kind of in place unless they're trying to get away, and explain what's going on. You know, Billy, I've got to put this arm to check you. I know you're not feeling very good. You know, it's going to give your arm a little bit of a squeeze, but I promise it'll be over very soon. Never lie. Never tell him it's not going to hurt. You know, when you get out IV stuff, kids freak out a lot of the time. Never say it's not going to hurt. Be truthful. It's going to hurt, but it's for just a second. It's super fast. I like to show them. So that seems to help quite a bit. So that's how I'd go about my physical exam. Normal vital signs for a child of his age. So your heart rate's going to be around 70 to 110 for a normal vital sign for a healthy child. Respirations are going to be between 20 and 30, and your systolic should be about 80 to 120. Temperature should be your normal 98.6. And so going about checking each one of those things so that you can go in and make a diagnosis. With all of those steps followed, with any time I've dealt with a child of that age, or most children of most ages, those steps really seem to help me be effective in my job, getting answers, getting vitals, taking care of them, comforting them, calming them, the whole 9 yards. Being truthful with them, being direct, being clear in your statements, no big words, and verbalizing each individual thing that you're going to do seems to really help when I treat a patient of this age. So I think that's it. All right, guys, next time.